This station is designed to test an EMT candidate's ability to control hemorrhage and manage shock. There are no assisting EMTs for this station. This station should take approximately 10 minutes to complete.
EMTs respond to many trauma calls involving hemorrhage and shock. Knowing the basic steps of bleeding control and how to manage shock can help save a life. In this station, the examiner will be testing your decision-making ability in several different areas of trauma patient management.
Candidates at this station will have the equipment necessary to successfully control bleeding and manage shock. The patient will be moulaged using items such as fake blood with prosthetic devices to depict the desired injuries. Equipment and supplies for assessing the patient can include a trauma kit with dressings and bandages to control bleeding. A blanket and supplemental oxygen are available for managing shock, and medical exam gloves are a part of the necessary personal protective equipment. There are two main sections of this station: bleeding control and shock management.
This is your bleeding control and shock management station. You've had an opportunity to check your equipment. Do you have any questions?
No.
If not, I want you to go ahead and treat this patient. He's got a wound to his left forearm. Go ahead and show me how you take care of the patient.
Begin the station by indicating that the proper personal protective equipment is being used.
I'm going to take BSI precautions.
Begin by applying direct pressure and elevating the extremity. If bleeding is not controlled, apply additional dressings and pressure to an arterial pressure point.
The wound continues to bleed. The second dressing still does not stop the bleeding. The bleeding has now been controlled.
With the bleeding controlled, bandage the wound to maintain pressure.
Now that you've controlled the bleeding, the patient begins to show signs of shock. What will you do now?
Once the wound is bandaged, care for shock by properly positioning the patient. Apply a high concentration of oxygen.
Support your hand. Good.
Prevent heat loss and indicate the need for immediate transport.
I need to immediately transport this patient.
Okay.
The examiner checks the candidate's performance against the critical criteria for the station. Items at this station that would result in failure include failing to take or verbalize the use of body substance isolation precautions, failing to provide a high concentration of oxygen, applying a tourniquet before attempting other basic methods of bleeding control, failing to control the bleeding, and failing to indicate the need for immediate transport.
A key to this station is to remember the basics of bleeding control: direct pressure, elevation, pressure bandages, and pressure points. Manage shock with patient positioning, maintaining normal body temperature, and supplemental oxygen.